Can you tell me your name and position?
David Quackenbush, President and CEO, Golden Valley Health Centers.
All right, thank you so much. We're talking to about Medicaid cuts right now. You put out that op-ed. Can you just sort of talk to me about what inspired you to write that? And because you really shared many of the community's concerns about cuts to Medicaid on the federal level, which could affect Medi-Cal. So what inspired you to write that?
So, there's really two motivations. One, folks need to understand the potential harm in the community. And then I guess you can say somewhat selfishly, Golden Valley Health Centers is a federally qualified health center. We've been in existence for 52 years. 165,000 patients are Medi-Cal patients. So any change, decrease to Medi-Cal will affect us directly, which will affect the patient care we provide to our community members.
Um, what percentage of overall funding to Golden Valley Healthcare Centers come from Medi-Cal reimbursements? And yeah, do you have those numbers?
Oh, sure. 80% of our revenue is from Medi-Cal.
Oh, wow. So if
Yes,
this,
yes, yes. It's very significant to us, yes.
so I know in the op-ed you were just talking about, reaching out to to congressional representatives. Have you spoken to any of them about this?
Yeah, so being a community health center, we're part of both of our national and state associations that we regularly do outreach and advocacy to our elected officials, both in Congress and in the state legislature. And there's the coordinated day. We went to DC in February, and we went to Sacramento in April to have these conversations. And so, but these conversations are part of our normal dialogue. So we have our electeds tour our sites. Their staff have been to all of our sites. Our electeds are very, very supportive of us, and they know, because of our long history, they know us very well. So we communicated with them directly on the devastation that these cuts could lead to. And as you would know, covering these type of issues, they are well aware of a reduction in Medicaid, what we call Medi-Cal in the state. They're aware of what the impact to the community would be if there's any reduction in resources going to the program.
What would be some of those impacts? Like just on a just sort of just understanding what impact it could be. What would we see if we have these Medicaid cuts?
So I'm sure, as you know, Medicaid is a dollar for dollar match. So every dollar the feds put up, the state puts in. And with the expansion population, it was 90 cents. It was a 90 cents to a dollar match. So the federal government even invested more heavily into California. But as you know, Medi-Cal takes care of low income families, the poorest folks that are our community members, and it pays for a very specific set of services that the state defines. So, for an example, somewhat recent history, back in 2008 during the housing crisis, which was the last time the state had such a big deficit, they read. There's only two things that the state can do. They can, based on the federal investment, the state can do two things. And just to round out the conversation, don't forget that the state of California has a $10 billion budget deficit, and the governor is putting out his May revise next week. So we think there's going to be double impact. The federal government is signaling some reduction in Medicaid. The state government has a $10 billion deficit that they have to close. So we are actually anticipating both the federal and state government decreasing resources that go into Medi-Cal. There's only two things they can do. They can cut eligibility, which means folks that are currently eligible may or may not continue to be eligible, or they can decrease services. So in California, and California deserves a ton of credit, we have a very robust set of services that are part of the Medi-Cal program, and we cover almost the entire population that's eligible based on income, as you know, regardless of immigration status and based on their income alone. So they can reduce eligibility or they can reduce services. Back in 2008, during the housing crisis, when that was our last really big state budget deficit, they eliminated what is called optional benefits. And what those are in California, those are what can be characterized as specialty services: adult dental, chiropractic, podiatry, and a whole list of other services that are part of our normal services we provide to our patients. We're no longer eligible to be reimbursed via Medi-Cal. So essentially, if we don't get paid for the services we provide, obviously it's very hard for us to sustain those services. We might be able to be creative to sustain a fraction of those services, but just like any healthcare provider, you can only go so long providing the service that you're not getting reimbursed for. So
Mhm.
that's really the only two choices they have, right? The federal government provides their investment. The state determines how that investment plays out, and it's really about minimizing who's eligible or minimizing the services that are able to be provided through the program.
You talked about how you've been anticipating cuts both on state and federal level. How drastic do you think um, are your projections? Like, are you anticipating sort of a very large cut with, because I know there has been confusion about how much is going to be cut and what they want to do in Congress. But how drastic do you think this could get?
So I always hesitate to venture a guess because, as you know, politics is a animal all to itself, and things play out in different ways. And there's been a lot of misinformation coming out of DC primarily, so we try not to act on the information. We need to act on the actual results, which are still at DC. They're probably not going to get to any actual decision making until they're predicting 4th of July, which is somewhat of a ironic date. Just based on me being working within community health centers for 25 years, experiencing ebbs and flows over the years. I anticipate some restriction on services and some tightening of eligibility. Some of the I got to be careful how I say this. Some of the maneuvering that they do to reduce folks that participate in the program is they institute work requirements or they institute more regular redetermination. So, years ago, folks had to redetermine monthly or every 6 months to be eligible for the program. And just human nature, folks miss the mail, folks don't, fill out the form. So that's kind of a way that some policymakers dictate how to reduce participants in the program. So I anticipate them doing something to shrink eligibility and services, but I don't. I would be remiss to try to venture a guess. I mean, for
Mhm.
Golden Valley and all the other health centers in California, there's over 100 health center corporations in California. There's over 1,000 clinical sites, and we're in the same situation as all of our colleagues around the state. We just have to plan as well as we can and pay very close attention to be able to make decisions once the makers make their decisions.
So is there, I know you get 80% through Medi-Cal. Are there under any other strategies you guys are looking at when it comes to just sort of private funding or other programs that are out there that you'd be able to sort of maybe, I guess maybe supplement? I don't know if that's the right word, but is there any other avenues that you're looking at in terms of private dollars that would be able to help? Or is this kind of like, we need to stop this?
No, we need to stop this. It's not realistic to rely or anticipate funding coming from somewhere else. I mean, just the state alone, that's $10 billion, right? So there's been some conversations around the state, depending on what the federal government cuts, the state potentially investing more in the program. But that's really unrealistic with the state being having a $10 billion hole. And there's no foundation or there's no, you know, other government entity or private foundations that can really close the gap. I mean, for Golden Valley, we have 165,000 patients, which translates into 55,000 appointments a month, which is a significant volume and a significant level of resources that come in from Medi-Cal, and there's really no realistic source that could fill that hole.
Okay. And what kind of services does Golden Valley Health Centers offer that's mostly um, used through Medi-Cal? Is there any particular service that's mostly used, or is just sort of primary care?
No, we provide comprehensive services. So primary care is always the foundation of Medi-Cal and of community health centers. But because we've been around so long and because we've been strategic in expanding our services, I mean, we provide primary care. Then we have 24 other specialties in house. So, women's health, pediatrics, internal medicine, behavioral health, and then all the what you would consider typical specialties, cardiology, oncology, nephrology, and on and on and on. And all of those services are reimbursable by Medi-Cal. I mean, the state of California deserves a lot of credit for covering a lot of services and a lot of people in the Medi-Cal program. So I want to make sure you understand that.
Mhm.
But again, if they reduce the investment in the program, some of those services are going to go away.
Mhm. So one thing that's coming up that was mentioned was Medicaid Day of Action on the 14th. Um, what are you anticipating seeing that on that day? What are your messages for that day, and what do you hope comes out of that?
Similar to the op-ed that was shared, it's a coalition of health centers really around the country that are going to be delivering the same message on the same day, really that we've been delivering, but that energy and that collective advocacy will really, really highlight and elevate the messaging. So, we'll phone bank, we'll do more media, we'll reach out to our electeds, both at the state and federal level, and just that real big push by health centers across the country the same day, I think will really resonate with electeds. And I think the elected officials are listening, and I think some of the language has been tempered, and I think we're getting across the concerns. But as you know, the president has essentially given Congress a dollar amount to cut, which is why they're in this precarious position. And so that dollar amount really doesn't take into account all the services and the patients that are served in the Medi-Cal program.
Oh yeah, I was reading about Congress and how Mike Johnson, I think, has repeatedly said that, or Speaker Mike Johnson has repeatedly said that they weren't going to be as aggressive on Medicaid cuts, but there is this resolution saying that they want to cut $880 billion over 10 years. Do you think that that Medicaid that's sort of the only way they can go? Or like why is it that Medicaid is the one thing that they seem to be going after or seems to be the focus of cutting?
Well, I mean, I think to state the obvious, the Republicans haven't been in favor of Medi-Cal probably since the program was created. And so I think just the kind of, if you look at it from a historical generic perspective, Medicaid at the federal level, Medi-Cal in California hasn't been widely supported by Republicans historically, just based on kind of Republican conservative principles. But I will tell you, which is what's happening, is since the ACA was implemented, the Obamacare was implemented, more and more red states expanded their Medicaid program. Because don't forget, Medi-Cal is really for working poor. And there are working poor throughout this country in urban, suburban, rural areas, in Republican and Democratic districts and states. And so the Medicaid population has expanded tremendously in most states, including many, many, many traditionally Republican states. So many newer Republican Congress people, they acknowledge that and they support the program, they support their constituents, and those are the ones that have been really pushing back on these dramatic cuts to get to that 880 number. Um, but it's really we have to see what happens because that's the number they put out, and now they're somewhat kind of forced to get to that number.
Now, Speaker Johnson did say that they weren't going to pursue these federal cuts to Medicaid. Are you confident in that? Do you think this is always just going to continue to be a target and everybody has to be on their toes?
Did you say he said he was not going to?
Yeah, so I saw an article earlier saying that Republicans were not going to pursue a federal funding cut for Medicaid. I think it was also in the New York Times.
Well,
If
I haven't seen that, nor do I believe that because
they were being kind of vague about it because I know he's repeatedly said that, oh, we're not going to pursue that, but that seems to be the only way they can get to that $880 billion number. But they
well,
have
right.
kind of
That's been the sense, right? That 880 number. The only way you're going to get to that is by cutting Medicaid. They're not
been,
going to touch Medicare. And there's no other. I mean, there's other federal programs like the military and other things that are that sizable. But that's why Medicaid's always been on the chopping block. And then again, you can get into the political rhetoric and the nuance, because and this might be getting too far in the weeds, but when they implement a work requirement, or they implement that Medi-Cal recipients have to redetermine more often. That's just another way. That's just another way to get people off the rolls. So they might be doing some um, creative dialogue. So saying they're not going to just cut it, meaning they're not going to like cut $100 million for the program. They could implement a lot of policies that will lead to less people on the program, which is still a cut.
mhm. Yeah, so yeah, I see a few articles here already. That yeah, it seems like they're backing away from it. Maybe they haven't like fully committed to not going after it. But it seems like there's kind of a third rail where they're just like, okay, maybe we won't do this. But they haven't, I guess, decided. But yeah, it just seems like Medicaid is always something that is on the menu for Republicans to cut. I know Trump has said, "Oh, we never proposed to cut Medicaid," but then in his first term, he very much tried to, and then dismantle the ACA. So it just seems like this is always a target of theirs, and you can never really rule out it. And how does that, as a somebody who's in the healthcare field, as a CEO of healthcare centers, when you constantly have these threats going towards your funding, how difficult is it to operate under those conditions?
Well, it's always very difficult to do what we do. I mean, again, 80% of our revenues is coming from the Medi-Cal program. So we are dependent on the federal and state governments to be supportive of these services for low income families. So there's always a nervousness, or there's always reservations. And we try to be very careful on how we operate, very slim margin. We're very conservative with our growth, just to make sure we can weather any storm that might come. But as you know, it's a different day today because we have Republicans that control the Senate, House, and the president. And so we haven't had this dynamic in quite a while. And before, when either the House or Senate or president was Democrat and we had a mix of parties leading the country, it led to a good amount of dysfunction. But at least they didn't have the ability to make drastic cuts because they pretty much couldn't decide on anything, right? But this is a new day, and we just have to weather the storm because it's our business to take care of these folks, and we're going to keep doing it. And we just need to make sure that our elected officials continue to provide support for us and don't make any cuts that are too dramatic to our patients.
All right. I just have two more questions. One is just on the ground level, on a personal level from patients, when they're hearing about these cuts, what are you hearing from them and just either an anxiety or trying to reassure them of what your healthcare center can offer? What are you hearing from your patients and the people who use your services?
Our patients are definitely nervous, and when our patients come in, they ask, am I gonna be able to see my doctor? Are they gonna cut my insurance? So yes, they're definitely nervous, and our staff do a really good job of educating them. I would also tell you what's very interesting with our dynamic, which is very similar to a lot of health centers across the state and country. Golden Valley's been here for 52 years in the same counties. And so our patients come to us whether they're on Medi-Cal or they're uninsured. We're taking care of generations of parents, great grandparents, grandparents, parents, kids. And because they've been coming to us for so many years and they've been getting consistent quality care from us, and they have their favorite doctor that works for us at whatever site they go to, they come to us whether they're insured or not. And so the reality for us, it's twofold, right? That's great. Patients still get access, patients can still see their provider. But for us, a reimbursable visit turns into a non-reimbursable visit, and it makes it very difficult for us to sustain those services. But our patients, for the most part, come to us whether they're insured or not, which is another dynamic of kind of the community health center system.
And my last question is, it was more about undocumented immigrants and being on Medi-Cal, because I know Newsom applied for or asked the state legislature for a loan in order to cover what he didn't anticipate it being that much. What are your thoughts on that? And what are your thoughts on just making sure that services are available for undocumented immigrants?
I mean, first and foremost, we see anybody who walks in our doors. We don't care if they're documented or not. That's fundamental to the community health center program nationwide. So the way we do business does not change. So whether they're insured, whether they're insured, uninsured, documented, undocumented, we take care of anybody that walks in our door. My concern with the state government's perspective and the way you kind of just characterized the governor's comments, I find it interesting that they appear to be blaming the expansion of Medi-Cal to undocumented folks as the reason for the deficit. I'm uncomfortable with that. I mean, for one reason why we have to pay attention to our operations and our finances. I'm not sure why the state didn't know the program was running at a deficit. And then also, I don't really, I wouldn't look at the Medi-Cal program as a specific piece of the eligible population causing the deficit. It's the entire program. I mean, it doesn't matter what service, it doesn't matter what the patient is. I find it a bit disingenuous to blame undocumented as the reason why the Medi-Cal program has a deficit.
All right. Do you have a final message that you want to make sure people hear when they come out of this conversation or hear this story?
I mean, yes, a cut to Medi-Cal just creates more uninsured. It creates more sick folks, less preventive care, and it really destabilizes the healthcare system and the healthcare workforce. I mean, we have 1,200 employees. If there's a reduction in services and revenue, there's going to be more unemployed folks.
All right. Is there anything we didn't cover that you would like to cover more?
No, I think it was good. I appreciate the opportunity.
All right. Thank you so much. Have a good one.
All right, have a good day. Thanks.